All the things you need to know about HPV. The virus itself. HPV stands for human papillomavirus. You can get HPV from vaginal, anal, or oral sex with someone who is infected with the virus, but HPV typically enters the body through regular skin-to-skin contact. The virus can enter your body through a small cut or tear on your skin. Some studies have suggested that you can get HPV from kissing, but there are not enough studies to support that statement. HPV can be hereditary, but it is very rare. If a baby gets HPV from the mother during childbirth, the baby's genitals or respiratory system may develop an infection. There are over 100 different types of HPV that can cause warts on different parts of your body. Out of the 100 types of HPV, there are more than 40 strains of the virus that cause warts around the genital area: the vulva, penis, scrotum, cervix, rectum, anus, and vagina. The virus can go undetected. The scary thing about HPV is that you can have the virus, but you may not see any symptoms for years after getting infected. HPV is so common that nearly all women and men who participate in sexual activity will have it once in their lives, but most people who have it, or have had it, will not realize it. Why? Most people who are infected with HPV, or who have been infected, will not experience any harmful effects, or noticeable symptoms. Most types of HPV are harmless. 90% of the time the body's own immune system will destroy the virus within 24 months of first catching the virus. HPV can lie dormant in the body for extended periods of time. Symptoms of HPV. The average HPV incubation period, the time it takes to show symptoms, is 2 to 3 months, but the incubation period can vary greatly from months to years, if you even experience symptoms. HPV falls into two types of categories: low risk and high risk. Low risk HPV. People who have low risk HPV will experience no symptoms at all or may experience warts on any part of their body. High risk. People infected with high-risk HPV can get cancer from the virus. When HPV does not go away naturally, abnormal cells can form and cause cancer and precancerous lesions. High-risk HPV can cause cancer in the cervix, vagina, vulva, penis, throat, and anus. Getting tested for HPV. If there are warts, healthcare professionals can sometimes diagnose you with HPV through a physical. There is no HPV test for men. Women usually have to find out they have HPV from an abnormal pap smear. A pap smear looks for and detects abnormal cell growth. A pap smear looks for and detects abnormal cell growth. A woman's HPV test finds the source of the abnormal cell growth. If you are a woman older than 30 years old, it is recommended that you get a pap smear just to be on the safe side. Treating HPV. There is no medical treatment available for HPV. Treatment is available for treating warts and precancerous lesions caused by the HPV. Treatments and surgeries for warts. Salicylic acid. This medication removes warts gradually, by removing the wart layer by layer. You can buy this type of medication without a prescription as an OTC, over-the-counter, medication. You should not use this medication on genital warts because it may irritate the genital area. Cryotherapy. It can be used to freeze the warts with nitrogen. After frozen, the warts will fall off. Trichloroacetic acid is used for burning off genital warts. Podophylox, Condylox. A prescription is needed to use this drug for treating genital warts. Imiquimod, Aldara, Zyclara, a prescribed cream that treats genital warts. Laser surgery. Laser burns the warts off. Surgery. A surgeon cuts off the warts. Treatment for precancerous lesions. cryosurgery the cancerous lesions are frozen, destroying them. LEEP, loop electrosurgical excision procedure, a hot wire loop is used to remove cervical tissue. Laser surgery, laser used to destroy cancerous tissue. Excisional surgery, cancerous lesions are cut from the body. How to prevent infection, vaccination. Vaccines can prevent certain types of HPV, but not all types. Boys and girls between the ages of 11 and 12 are encouraged to get vaccinated. Males under the age of 22 and females under the age of 27 should get vaccinated if they did not get vaccinated when they were younger. Men who have sex with men and people with compromised immune systems under the age of 27 are also encouraged to get vaccinated. Safe sex. Use condoms and dental dams when you participate in sexual activities. Limit the number of people you participate in sexual activities with. Try to have sexual partners who have had a limited amount of sexual partners, as this will also lower your risks of getting infected. Good hygiene. Wash your hands after using public facilities and before eating. Do not bite your nails or you will increase your chances of getting genital warts around your fingernails. Cover cuts. Cover tears, cuts, or lesions with bandages and keep them clean to lower the number of possible entryways for the virus.